So my topic for today is minerals in nutrition. Minerals play a very important role in development and maintenance of proper functioning of human body. So we will see what are its types and roles in a body. First, we'll see what are minerals. That is, minerals are nothing but inorganic elements needed by the body for functions like building tissues, regulating fluids, and assisting in bodily processes. They form very small portion in a total body weight, that is 7%, and they are widely distributed in a food so well that a well-balanced diet will supply them in sufficient quantities. And coming to its classification, they are classified into two types: principal elements and trace elements. Principal elements which are required more than 100 milligram per day. That's why they are known as macronutrients, and trace elements which are micronutrients required less than 100 milligram per day. So these are the macro and micro minerals. Some of the important macro and micro minerals we'll discuss accordingly. So first, in a cumulative way, I can just say about the minerals absorption. That is a normal diet composed of plant and animal stuffs, so should supply all the minerals required by the body. And when such diet is not available, it may be necessary to provide missing elements in the form of supplements or by fortifying the diets with additional minerals. Also, not all minerals are readily absorbed, some to the same extent. Some, including sodium and potassium, they are like readily absorbed as ions or simple compounds. And others such as calcium, magnesium, phosphorus, they may be combined as indigestible or insoluble compounds and are less easily taken up from the gut. And trace elements such as iron are poorly absorbed. So these are the reference nutrients intakes which is required. We'll see one by one accordingly. Under the headings of these types, what are its types, sources, function, and health implication. First and foremost, we'll come to calcium, which is a macro mineral and constitutes about 1.5 to 2% of body weight. And average adult body contains about 1200 gram of calcium, of which 98% is present in bones. Calcium in blood, normally it is 10 milligram per dl. And its absorption when taken, it's 20 to 30% normally it is absorbed, and retention is just 10 to 20%, which also depends on diet and age. Also, in the presence of vitamin D and high protein diet, there is enhanced absorption of calcium, and its absorption reduces in presence of oxalates, phytates, fatty acids, and fibers in diet accordingly. So as its RDA is high, that is 1000 milligram per day, some of the important foods which are absorbed accordingly, that is less than 5% of calcium is we get just from spinach or Swiss chard accordingly. And most important source of calcium, that is milk and fortified soy or milk products in cumulative, we can say approximately 30% is absorbed from milk. And high source of calcium, among which is more than 50% is absorbed from cauliflower, Brussels sprouts, broccoli, turnip greens, that is shalgam, and these things. They provide good amount of calcium in a body. Coming to its function, as we know, it forms and keeps bones and teeth, formation of bones and teeth, and also helps in nerve conduction and contraction of skeletal and cardiac muscles. Also, it supports normal blood circulation and helps in our bodies release certain types of hormones. Health implication, coming to its calcium deficiency in adults, it leads to osteoporosis and fracture of brittle bone, and in children it leads to rickets, decreased rate of growth, and hyperirritability and tetany. Its toxicity, that is calcium hypercalcemia, it occurs due to excessive intake of calcium most commonly, which is mostly seen in elderly, leads to increased bone fracture due to high remodeling rate. Also, hypercalcemia leads to excessive calcification in soft tissues, especially kidneys. And most important thing, high intake of calcium also interfere with the absorption of other minerals like zinc, iron, and manganese. Next is phosphorus among our minerals, which is about 0.6 to 1% of adult body weight. 85% is present in bones and teeth. and it exists in two forms, that is inorganic and organic compounds. Inorganic salts like calcium phosphate in bones and teeth, and phosphates of sodium and potassium. And in organic compound, it is present as phospholipid in lecithin, cephalin, nucleoprotein, creatine phosphates, and hexokinase. So we can see, as in this dietary sources and absorption, that is as its RDA is 700 mg%. Low phosphorus absorption is phosphorus is present in low quantity in certain types of food like wheat, cornflakes, pasta, or we can say some green or leafy vegetables. They have very low amount of phosphorus. Protein rich sources such as milk, red meats, legumes, they have high amount of phosphorus. They are phosphorus rich, hence they should be included in our diet to have proper amount of phosphorus in our diet. As its functions, it combines with calcium accordingly to form bone and teeth, also required for formation of phospholipids, carbohydrate metabolism, and formation of nucleic acid and nucleoprotein, which are integral part of our DNA. Coming to its health implication, with calcium, phosphorus forms calcium phosphate, which is major inorganic molecule in our bones and teeth. Hence, deficiency leads to musculoskeletal disorders like rickets in children and osteomalacia in adults, whose symptoms are bone pain, muscle weakness, stiff joints. Neurological symptoms are confusion, weakness, paresthesia, numbness, and hematological like anemia, and it increases susceptibility to infection. General symptoms like fatigue, weight loss, and loss of appetite is seen, and severe complication leads to rhabdomyolysis. Coming to next and most favorite of many people, because sodium chloride, because chutki bhar namak is very important for everybody's taste. So human body contains about 100 gram of sodium ion. Sodium is lost from the body through urine and sweat. That is passed out in urine, regulated by kidney, and lost by sweat is not controlled. Because of presence of climatic change during summers, there is a sudden depletion of sodium in our body. Depletion that leads to muscle cramps, and its requirement also depends on climate, occupation, and physical activity. Adult requirement is approximately 10 gram per day, but there is a strong relationship between hypertension and dietary salt intake, which has been observed. An intake about more than 10 gram salt per day is considered to have definitive tendency to increase our blood pressure. Important dietary sources are table salt, pickles, seafood, and canned food. So its health implication, while other minerals are deficient in a body, just sodium is normal or high most of the time, and which is a risk factor for hypertension. Also, excessive salt intake leads to increased urinary secretion of calcium, leading to osteoporosis, and affects stomach mucosa, causing gastritis, atrophic gastritis, and carcinoma stomach. And its RDA is also very high, approximately 1600 milligram per day, but as we can see, because of processed food, it is equivalent to 50 to 60 potato chips, or 2 large pickled or canned soup accordingly. Also, some of the brands, they advertise that noodles is a light meal to be enjoyed as a part of diversified balanced diet. But if we see, per 100 gram of such noodles, they contain 1200 milligram of sodium, which is approximately 70 to 80%, which is present in our diet per day we need. Coming to chloride, which is rarely lacking, and as it is a part of sodium chloride. Next is potassium, which is in adult human body contains about 140 gram, which is vasoactive, increases blood flow, and sustains metabolic need of the tissue. Also, high dietary sodium and low potassium have been implicated in etiology of hypertension. So, ideal sodium is to potassium ratio should be around 1:1 in our diet. And important sources are fruits and vegetables, some fresh meats and dairy products. Health implication like low potassium can result from severe diarrhea. Insufficient intake can lead to arrhythmia and hypertension. Symptoms which include weakness, mental confusion, and heart failure. Potassium or RDA is also 2 gram per day, and this is one of my favorite slide which shows ki, what processing does to sodium and potassium contents of our food like milk, meats, vegetables, other fruits. The purple marking shows potassium content and yellow is sodium. So accordingly we can see unprocessed food, they have high amount of potassium and low sodium, but once they are processed, sodium contents drastically increases, which is not good, not at all good for health, let it be any kind of food. Hence, and most probably it is seen in fast food and on to go to food which are consumed by mostly hostel and the young children, causing different types of heart related issues in recent years we are seeing. Also, next coming to magnesium, which is in human body around 5 gram of magnesium is present, of which 50% is in combination with phosphorus and carbohydrate. RDA is 200 to 300 milligram. High magnesium foods are buckwheat grains like which is suji or rava we say, bananas, cashews, pumpkin seeds, spinach, some type of meats and almonds. Its health implication: deficiency is characterized by depression, muscular weakness and vertigo, which is commonly seen in chronic alcoholic, liver cirrhosis, protein energy malnutrition, malabsorption syndrome and toxemias of pregnancy. So this completes our some of the important macro minerals. Now the trace minerals which are required less than 100 milligram per day and also known as micro mineral. So first and foremost is iron. In an adult human body contains between 3 to 4 gram of iron, of which 60 to 70% is present in blood as heme form. Once it is ingested, it is converted to ferrous or absorbable form by help of reducing substance. Absorption takes place from duodenum and upper jejunum, which is affected by whether it is heme or non-heme. If vitamin C is taken with iron, iron absorption increases, and there is reduced iron absorption when diet contains phytates and oxalates. The RDA for male for iron is approximately 8 milligram per day, and for female and pregnancy it is 18 to 27 respectively milligram per day. As you can see, this sources, most important sources, the vegetarian sources which have sufficient amount of iron, which is marked in brown, but absorption is very low in all this. That is, if we can say black beans, spinach, just 1.4%, or black beans, it is just 1.6%. Soybeans has 7% of iron among which it is absorbed. But some of the non-vegetarian sources like chicken or calf liver, they have high amount of heme, and about 18%, 15, 20% accordingly they are absorbed from non-vegetarian food. Hence, vegetarians need approximately 1.8 times as much iron because of low bioavailability. Coming to health implication, deficiency leads to anemia and excess leads to cirrhosis and hemochromatosis. Here you can see hemochromatosis hand in comparison with normal. Next, coming to iodine, which is an essential trace element. Human body contains about 15 to 20 grams of milligrams of iodine. Goitrogens such as cabbage, cauliflower, they interfere with its absorption, leading to goiter. Also, its RDA in adults is 150 microgram per day, and in pregnancy and lactation is approximately 250 microgram per day. Most important dietary sources are seafood, fortified salt. But nowadays, iodine related issues are being increased because of too much promotion of pink salt or rock salt. So we have to be a little bit vigilant with our patient to ask them to continue fortified salt accordingly. Health implication, as it plays important role in synthesis of thyroid hormones. Deficiency in adults leads to goiter, and in children it leads to cretinism. Coming to next, that is zinc, which is an essential component for more than 300 enzymes, which is required in synthesis of insulin by pancreas and for immunity function. A human body approximately contains 1.4 to 2.3 gram of zinc. And there are also reports of low circulating zinc level in clinical disorders such as liver disease, pernicious anemia, thalassemia, and MI. For its function, most important function is immune responses because it helps in building immunity and also in healing. Health implication, its deficiency is most commonly seen in children of developing country due to lack of animal food intake or phytate content in high dietary phytate content, or inadequate food intake, increased fecal losses during diarrhea. Hence, it's implicated along with ORS zinc supplement to be added to reduce the duration and severity of diarrhea. Otherwise, health implication like we can see acrodermatitis, enteropathica, loss of taste, acuity, alopecia, and delayed wound healing has been seen. Its RDA is 15 milligram per cent, and these are some of the food which contain zinc content in them in milligram per 100 gram. Like high zinc content is seen in oyster, which is 87 milligram per 100 gram, along with low, less than 10 milligram percent is seen in pumpkin seeds, crab, cashew, or we can go with almond, chicken, milk and yogurt, milk and milk products. They contain very less amount of zinc in them. Next and most important is fluoride, which is required in very small amount, that is just 3 to 4 milligram per cent. But 96% of fluoride is present in body is found in bones and teeth. It is required for mineralization of bones and enamel formation. Major sources are water and some seafood or cheese. Toothpaste fortified with fluoride is also an essential source for many people because of too much of filtration and of water. The fluoride content reduces in the water which we drink. Hence, toothpaste fortified with fluoride is an important source of many people for fluoride. Also, fluoride has been implicated as a two-edged sword because excess leads to fluorosis of dental and skeletal fluorosis. Deficiency leads to dental caries. Next is copper, which is 100 to 150 milligram of copper is found in human body, required for bone and bone development, elastin formation, iron absorption, and tyrosinase. RDA is 900 microgram per day, and sources are nuts, seeds, whole grain cereals, and chocolates. Most important sources, I can say just chocolate, but still there is chocolate which are approximately 50% dark chocolate, not the sugar ones which we get of 10-20 rupees. Deficiency leads to cardiac hypertrophy, aortic aneurysm, and impaired bone formation. Excess absorption is seen in Wilson's disease, causing KF ring such thing. Other trace minerals, that is manganese, whose deficiency is rare. The trace minerals, the deficiency has not been seen much, hence very less they are discussed accordingly. Like manganese, whose deficiency is rare, cobalt, which is a part of vitamin B12 molecule, no evidence has been of deficiency has been seen still. But recently, cobalt deficiency and cobalt iodine ratio in soil have been shown to produce goiters in humans. Also, selenium deficiency leads to protein energy malnutrition, and molybdenum. Excess absorption of molybdenum has been shown to produce bony deformities. Deficiency is associated with mouth and esophageal carcinoma. Chromium is also has its role in carbohydrate and insulin function. Treatment, or most nicely we can say, it is corrected by improving the diet and providing supplements for the deficiencies accordingly. And for many people, supplements are important source of minerals, and minerals available in number of chemical form, that is inorganic or organic preparation. Inorganic, that is ferrous sulfate, calcium carbonate, or organic preparation such as selenium yeast and zinc gluconate. But the backbone of mineral supplement is a balanced diet. So we'll just go through this pyramid, which is a balanced diet, which base of it is formed by whole grain legumes, and large servings we should contain in a regular diet, along with some fruits, vegetable, nuts and seeds, vegetable oil, egg and dairy products, and sweets, along with lifestyle recommendation like daily exercise and 3 to 4 liters of water and sunlight at least 10 minutes to activate vitamin D. So takeaway message for today is prioritize your mineral health Balance is essential, that is strive for well-balanced diet to cover macro and micro minerals of your body needs. To manage absorption, we have to be mindful for the factors that inhibit absorption, that is phytates, oxalate. Also vegetarians who need more 1.8 times as much iron due to bioavailability. And we have to mind the gaps, that is deficiencies like anemia and goiter, through diet improvement and targeted supplementation. The final thought would be the diet is a backbone of mineral health, and use of supplements should only be used to bridge nutritional gap, for not replace quality of food. Thank you. English, so we should not combine them accordingly, and we should actually. I know it is very important, very tasteful. Uh, so that shouldn't be taken along with iron, zinc, and manganese. They also interfere with absorption of calcium. Yes, which has most of the times they form this formulation like iron and calcium in the same supplement, which I have also raised this query, which pharmaceutical companies, they have said it is actually the delayed release which they do in stomach, like calcium is released and first and then iron is released, so that they do not combine and absorbed accordingly or according to our RDA.